Hi, in this video, I'm going to be talking about complementary therapies. Things that might be available to you to help you get through treatment before, during, and after treatment. So I just want to make clear that complementary therapies are different from alternative therapies. It sounds like a really similar concept, and for some people there's a blend, but complementary therapies generally complement the medications and treatments we talk about on our Yerbba YouTube channel and on yerbba.com. Alternative therapies tends to refer to treatment instead of more standard allopathic types of medication and treatments. So when you're talking to your doctor and your team about complementary therapies, this does not mean you're saying no to what we know is evidence-based, but rather you're augmenting your treatment or complementing it with other things that actually, we talk about, sometimes we'll talk about the kind of treatment I give as conventional medicine, when acupuncture, for example, and yoga are much, much older than any of our chemotherapy drugs or older than radiation therapy. These are ancient traditions that people all over the world know have helped people with a variety of conditions. Now, in medicine, the evidence base that we require for something to meet the standard of, evidence-based treatment can be really high and requires things like a randomized controlled trial. So a lot of the things I'll be talking about have not been studied in randomized controlled trials, and a lot of them have. The other thing is, if they're not harmful and they don't contradict the treatments that you're getting from your medical team, and we know they help in other settings, do we really need the threshold of a randomized controlled trial? I think when you're spending a lot of money, the answer would be yes. You want to make sure you're not wasting your money. So I'm just going to say a word about supplements right now. Really, the best thing to do in terms of supplements is to get any micronutrients in your diet. We don't want supplements that have been handled, man-made, altered in a lab where the content, what we know is in there, hasn't been tested. So anything that hasn't been tested for purity could actually hurt you. There was a complementary therapy called Laetrile that was a hoax and exploited people in need. And we know people were taking fish oil, which can actually cause inflammation of the liver in some people. So I try to stay away from things that are man-made and derived from animals without any evidence. Okay, let's go back to complementary therapies. I have a list here and I'm going to read from it just so I don't leave any out. So acupuncture, massage, yoga, meditation, expressive writing, and herbal supplements, which I'll talk about separately at the end. So each of these therapies has been shown, some of them in randomized controlled trials, to help with specific side effects of chemotherapy. One example is acupuncture. Acupuncture, given along with other medications, can decrease nausea and vomiting related to chemotherapy. And if you're getting radiation to the abdominal area, also from radiation therapy. It's really hard to do a study where we randomize people to a control group because the effect of being in an acupuncturist's office is very relaxing, and that alone can help you manage your nausea. Even when we do acupuncture where they use sites that are sham or not the real sites for acupuncture, people get a benefit from that too. So you might hear skeptics regarding acupuncture saying it doesn't help because it's been so hard to study. Recent work compared to no acupuncture is pretty compelling that it does help, and it's non-invasive, it's a very ancient art, it won't cause harm. Okay, next, massage. Massage can help release all the knots, it can help you sink into your body, be present in your body. And when you think about all the things we do for breast cancer treatment, they're pretty noxious, right? Like you're in a gown, you're getting stuff stuck into your vein, Your dignity is taken away because you look like everybody else. You've lost your hair. A massage is a really good way to celebrate your body. The other thing is skin is our biggest organ, and touch, therapeutic touch, can be really helpful. So if you have access to massage, it doesn't need to be a whole body massage. It can be a foot massage or a hand massage. Take advantage of this. And sometimes massage therapists are actually available in the treatment center where you're getting treated. So definitely take people up on an offer to get massage. If your friends want to go in on a gift certificate, that's a big yes. Let's talk about meditation. Meditation has been known for centuries to help people feel more present, to feel more in control, to manage anxiety, to manage calm, help you feel more calm. Meditation and mindfulness in people who've had trauma can actually be very difficult. So if you're being advised to practice mindfulness meditation and you have a history of trauma in your family, it would make sense to make sure you're going to somebody or getting help from somebody who's trauma informed, because being mindful can actually be really difficult for people who've had trauma in their past. I always just want to make a note of that. Yoga, ancient art, helps with grounding you, helps with flow, can help with flexibility. There are lots of things it can do. There's weight-bearing yoga, and you can generally find yoga classes in community centers. There's yoga online now that you can do. Workplaces will often have yoga videos, and with the exception of movement of the shoulder, you want to make sure you've been cleared to move the shoulder after surgery. There's really no reason not to do yoga. I just want to acknowledge that brown and black people have developed yoga, and a lot of white people have appropriated yoga for profit. So you'll want to go to a place that's friendly to all sorts of marginalized communities. You really want to be aware of what's happened to yoga in the Western world. I also have expressive writing. James Pennebaker has done a randomized trial in people with rheumatoid arthritis, where people were randomized to write about neutral things, write about their day, and the other group was randomized to talk about things that were really hard. And for people with both asthma and rheumatoid arthritis, in a randomized trial, symptoms got better. Inflammation was lower. I'm a big fan of expressive writing. You can do this with a group. You can do this with somebody in the treatment center. You can Google expressive writing. You can work with a therapist to write expressively about your feelings. This can be 5 minutes a day, and doing it first thing in the morning or before you go to bed at night can be very helpful. In terms of herbal remedies, there are some that have been tested in randomized trials that are safe. There are Chinese mushrooms that have been used to help decrease the risk of side effects. This is not my area of expertise. In general, allopathic doctors like me don't know a lot about this and will often give you a big stop sign. They'll be very hesitant. And I think that's with good reason, because anything that the liver has to clear, anything exogenous, anything made and processed outside the body is usually handled by the liver. And we don't want to see inflammation of the liver in response to something we don't know is safe. I recommend that you talk with your doctor and be prepared for them to say, I don't know anything about it, but let them know what you're taking. If you're seeing a complementary therapist who's outside of your treatment center, just let your doctor know. If they seem really uncomfortable with it, keep the dialogue open. One of the things we know is that a lot of patients, but up to 80% of patients, are using one of the forms of treatment I've already talked about, and a lot don't feel comfortable talking with their doctor. They feel like they'll be judged. They feel like they'll be laughed at. And my hope is that your doctor will have an open mind and listen to what it is that you're hoping to get out of complementary therapies. My impression is that people want to do everything they can to help themselves. They want to feel the best they can. That's a natural urge. You're doing all these other things, chemotherapy and radiation, that are pretty drastic. If you can do something like yoga, acupuncture, writing, going to a support group to help you get through it, to me that seems right. But again, keep the lines of communication open with your doctor. I've covered a lot of things in this very long video. I hope it's been helpful. Remember to visit yerbba.com to learn more about your treatment options. There are other resources out there. We'll put a website in the link below this video where you can go and read about different herbal preparations and some of the hype or selling around them. Remember, there are lots of people who are willing to take advantage of people going through a difficult time like you yourself might be doing. If this video has been helpful, click like and subscribe, because that will help other people who have some of the same questions find this video.